Gastroesophageal reflux disease is a condition where the contents of the stomach reflux back up into the esophagus or gullet and cause irritation or sometimes damage to the gullet. Heartburn is the symptom that's associated with reflux. People often use them interchangeably, but heartburn is the symptom, and that's a burning feeling which is felt behind the lower central breastbone. And it rises. Sometimes patients will also have regurgitation of acidic fluid into their mouth. If they have those two features, then those are typical symptoms of reflux. The GP will usually prescribe a diagnostic trial of medication. The medication works by cutting back the acid in the stomach, and that reduces the irritation in the esophagus or gullet. It's usually taken for a period of about 4 weeks, because most patients with reflux will have good relief of their symptoms by 4 weeks. So often patients will notice that they get symptoms with particular foods, and clearly if that's happening they can control that to some degree by avoiding those foods. Sometimes it's not possible to avoid those foods if they're perhaps going out, in which case they may need to take some medication, and it usually works best if they take the medication before they go, if it's one of the stronger acid suppressing medications. And of the other things, weight loss has been shown to be effective in control of reflux symptoms, and sometimes it might only need to be a few kilos. There are certainly some patients who notice that when they're a particular weight they're good. If they put on a few kilos they have trouble, and if they lose that again they may be good. So weight loss can certainly be effective. So I think that the patients need to understand why they're taking the medication, and they need to discuss with their doctor whether the medication is being taken just to control symptoms, in which case it's appropriate for the patient to adjust the dose, or whether it's being taken to prevent complications, in which case they shouldn't be stopping or changing the medication around. And a discussion with the doctor will help them to work out which of those groups they're falling into.